So many countries have been affected by the sudden and unplanned cuts to foreign aid. So what's the WHO doing to support them?
Thank you. Thank you, Isabel. And apologies, I couldn't be with you there. Of course, my spirit is with you. And my links with World Health Summit as a co-founder actually many years ago. So, of course, it's a great opportunity at least to join you virtually, if not in person. First of all, I would like to say Guten Abend. And there is a German phrase I like. Gesundheit ist ein Menschenrecht. I like that because health is a human right. And if people can take that to heart all over the world, whether it's a low income, middle income, or high income countries, I think they can make significant progress. But the first thing is to believe that health is a human right, a fundamental human right, and an end in itself, but also a means to prosperity. So I just would like to start from there. And I listened to the panel, starting from the opening from Her Excellency Minister Nina Vorken, especially one thing she said, I think is very crucial. National health depends on global health. So we cannot really protect ourselves as global citizens without solidarity and without global health. And then coming to your question, Isabel, many countries have been affected by the ODA decline. And I think you know many of the really sad figures. But at the same time, countries have really felt the withdrawal and the funding cuts, and they're trying to take their own initiatives. Of course, there's one thing I would like to say before I move into telling you how we are supporting countries. The US has every right to use its money the way it wants. I don't think anyone can criticize the US for withdrawing its funds or withdrawing its support. But one thing that could have been done is there could have been a transition or an exit strategy. For instance, about 6 to 12 months. And then countries who have been benefiting from the US generous support could have prepared themselves. So that's one thing I would like to raise. But then I have met many leaders from developing countries, and the current crisis situation actually they're saying is an opportunity for self-reliance. And many countries, many developing countries are mobilizing domestic resources to fill the gap. And that's, I think, the way forward. And many developing countries, or all developing countries, what they need is not charity. What they need is fair terms. Fair terms in investment, fair terms in trade, and fair terms in taking loans from the market, and fair terms in other ways. I think the chair of the AU said it earlier. And then what WHO is doing to help is two focuses. First, the immediate, because there is a gap immediately. And we're advising and supporting countries to generate funding from taxes on tobacco, sugary drinks, and alcohol. This is generating in many countries, I think, significant amount of money. And then the second is the long term. The long term is the most important. We are advising countries on how to build a social or a public health insurance system, both for the formal and informal sector. I think countries have the capability. As you know, I'm in Sri Lanka. And in Sri Lanka, health services are free at entry point. And the indicators they have are really as good as many of the high-income countries. They're doing this because, as I said earlier, they take health as a human right. And they use their own resources to the maximum or mobilize domestic resources. So Sri Lanka is a developing country, and there is no reason that other countries can do the same. So the way forward for the developing countries is first, fair terms, and second, mobilizing resources immediately using taxes, which we are advising. And second is to build self-reliance through the health insurance systems, both for the informal and formal sector. And it's possible because some countries have already done it for many years. So that's how we're trying to help countries. But the key is in the countries themselves. It's not what WHO supports. I see a mindset shift to move toward self-reliance, and that's key. And donors should help in building capacity at country level, of course, and if they focus on building capacity that is aligned to self-reliance, I think that could also speed up the process with which countries could reach self-reliance. So thank you so much, Isabel, and back to you.
I would just like to pick up on something you said right at the beginning of your answer, that, what was particularly damaging and devastating when it came to the withdrawal of aid was the sudden and unexpected nature of that. So could you tell us what strategy the WHO can take to become more resilient to future unexpected shocks?
Yeah. So due to the sudden withdrawal, by the way, people have died. And that's why I say if there was some exit strategy, we wouldn't have people dying because of the withdrawal of the US funding. But not only that, I think the US withdrawal and the decline in the funding from other donors is also going to roll back the achievements we have in many fronts, whether it's communicable or non-communicable diseases. By the way, I want to join my brother Jean Cassea in thanking Germany for the significant contribution to Global Fund, $1 billion, and not only that, to CEPI also $100 million. Thank you so much. Vielen Dank, Germany. And that, I think, will help. Maybe one thing, though, I'd like to suggest is with regard to all the global health partners with the resources that are coming, and WHO included, I think focusing on building capacity at country level will be very important, and supporting countries based on their priorities, and to truly believe that result can only come when countries are in the driving seat. And then for WHO, of course, for WHO, the last few months have been very painful. I need to be honest with you. Saying goodbye to colleagues is not easy. As you know, we're downsizing. And I had to meet, starting from senior management, sit with colleagues one-on-one and tell them the bad news and asking them to leave. And you can imagine how painful that could be. And of course, people understand, colleagues understand, but you know through what kind of storm WHO has passed, especially during the pandemic, to what level of stress our colleagues, WHO colleagues, have been exposed and working under stress 24/7. And to be honest, they don't deserve separation, actually surprise like now, because this is not the reward they would get after extreme working conditions, especially during COVID, and also for what they have delivered. But at the same time, we believe that this crisis is actually an opportunity for the organization to shape up, to focus on its core mandate, and to be more independent. And maybe going back to our how we're running the restructuring, we're using 3 principles: transparency, fairness, and humanity. And we have already reached a milestone at the end of September. And we will do our best. Of course, no process is perfect, but we will do our best to follow these 3 principles. But we're almost closing the restructuring and focusing on our work on supporting countries and moving on. And then coming to the opportunity, I think in every crisis, it's a matter of opening our eyes, but there are opportunities, and we see opportunities. But when I say opportunities, I can also share with you, I don't know, maybe some of you know, we saw this problem actually coming. That's why it was not difficult for us to see this as opportunity. We saw it coming when we started our transformation in 2017, 2018. At that time, we have concluded that the major risk for the World Health Organization is its dependency on few traditional donors. And we even underlined then, if any of the major donors reduce their funding significantly, we may get into a shock like now. But not only that, the dependency on few traditional donors is also compromising our independence, because with the big funding, some threads are attached, or some conditions are coming that may compromise our independence. So because of these 2 problems, we said we need to address this major problem. We didn't even say this is one of the major risks for WHO. We said this is the major risk for WHO. And the solution we proposed at that time was to broaden the donor base, so that in the future, not only we can avoid shocks, but also to ensure WHO's independence. And then several measures were proposed that are aligned with broadening the donor base. One is the assessed contribution increase. The second is creating WHO Foundation, which is already done. The third is the investment round. And the fourth is increasing some, the cost recovery mechanisms. If I focus on assessed contribution, by the way, Germany has the biggest contribution in this, and a very able person, Björn Kummel from Germany, has chaired the member states working group. They agreed to increase the assessed contribution by 50% based on our request. And not only that, we are also doing the other measures. So as we speak, that financial reform, the increase of assessed contribution by member states by 50%, has actually helped us to minimize the impact of the US withdrawal and the funding cuts from other donors. The crisis in WHO would have been even more serious if the finance reform was not implemented.
Dr. Tedros,
So thanks to, yes?
I will ask you to wrap up if that's okay.
Yes, thank you, because you asked me a
Very big question, I know, sorry.
big question, important question. So I will wrap up because I have to respect my moderator. So your question, the sustainability of WHO lies in that reform, which started in 2017. So there is no need to start a new thing. It's better to continue along the same line, meaning member states have already approved 2 installments the last 4 years out of the 5 installments they have decided in 2022. And it's a matter for member states to implement the additional 3 installments until 2031. That's one. And the second proposal we're making is, and we're assessing this, to create an endowment fund. This endowment fund is similar to what we have in Harvard and also Wellcome Trust. I have spoken to Harvard and I have spoken to Wellcome Trust, the secretariat and the board, and they're willing to support. If WHO can have these 2 pots, the increase in assets contribution, if it can be implemented, it will be 50% of our budget by 2031. And if we have the endowment fund side by side, this could put WHO on a sustainable track. And that means WHO can prevent future shocks and also ensure its independence and can continue to be an independent voice. And we can speak independently without fear of repercussion. So that's how we're trying to sustain. It's implementing what we have started, but we have the additional recommendation of starting an endowment fund. Of course, the other measures, which I said, the WHO Foundation, the cost recovery could also help. But the devil is in the financial model for WHO, and this has not been addressed for a long time.
Dr.
And we're
Tedros,
addressing that, and that will create the sustainability that you asked. And I call on all participants in the room. They can do this, especially with the endowment. We want you to help us and make it happen and make your WHO an independent institution. Thank you very much, and back to you. And sorry for taking time.
big thanks there to Dr. Tedros, who we miss a lot, and having him in person. Now, we have been hearing that there are leaders who are showing the way already on